am Dr. Ajay Sharma, consultant cardiologist and professor at Gandhi Medical College, Bhopal. Today, I would be talking on triple therapy for better control of hypertension. That is, use of 3 drugs for the control of blood pressure. Sometimes what happens is, like, if you're using single drug, then your blood pressure is not adequately controlled. Usme hame kya karna hai? That is what triple therapy is for. Triple therapy in hypertension management is a combination of 3 different classes of antihypertensive medications that work together in syncytium to lower blood pressure. So these 3 medications are of different groups, and they act together so that blood pressure is properly controlled. The 3 classes typically used are an ACE inhibitor, a calcium channel blocker, and a diuretic. And as I told you, each medication works through a different mechanism, which allows for a more comprehensive and effective control of hypertension. According to 2017 ACC-AHA hypertension guidelines, triple therapy can be considered as a treatment option for patients, number 1, with stage 2 hypertension, and number 2, for those with stage 1 hypertension and high cardiovascular risk. These high cardiovascular risks are evidence of chronic kidney disease, evidence of heart failure, or diabetes. In 2018 ESC guidelines, it was suggested that use of triple therapy in patients with hypertension who have not achieved blood pressure control with dual therapy, then triple therapy should be used. Guidelines also emphasize the importance of individualized treatment for patients, taking into account comorbidities, age, and other risk factors. It is important to note that triple therapy should only be prescribed by a healthcare professional with expertise in hypertension management. Since you would be using 3 drugs, hence you should be comfortable in using all these 3 drugs together. Healthcare professionals should carefully evaluate the patient's overall health status, comorbidities, and medication regime before prescribing triple therapy. They should also monitor patient's blood pressure and electrolyte levels. That is very important, and adjust the medication regime as needed. It is also important to educate patients about the importance of adherence to medication and lifestyle changes such as exercise and healthy diet. In conclusion, triple therapy can be a very useful treatment option for patients with hypertension who have not yet achieved blood pressure control with monotherapy or dual therapy, and or for those with comorbidities such as heart failure or diabetes. However, it is important to consider individual patient factors and to carefully monitor and adjust the medication regime as needed. And hence, one should be careful while using triple drug therapy, but they are very useful, particularly in stage 2 hypertension and those with comorbidities such as chronic kidney disease, diabetes, or heart failure. Thank you.